Anna, your texting came up.
Oh, great. Good. Oh, they sent the pink sheet.
Yeah, they
Good.
sent the pink sheet.
Good. We'll double check signatures in a minute. Do you have a minute to check this with me? Sure. Okay, sure. All right. So let's go ahead. I just want to pull open the original order. Let's double check it, and then we'll go back through the chart and check our labs and everything else with that.
All right, sounds good.
So go ahead. You read off the bag, and I'll double check on the order sheet.
All right, Joanna Smith, 1500-898-327, date of birth 10/10/62. This is Rituxan, 648 milligrams and 648 mLs of normal saline, and it expires tomorrow at noon. Infused per orders.
Infused per orders. Okay, so we'll titrate that up according to the orders on here. Okay, so I want to go back and figure and just double check the BSA with you, if you wouldn't mind doing that with me. So our height was 65 inches. Our weight was 145 pounds. And we divide that by 3131, and we take the square root of that, which would give us 1.73.
Okay.
And
that was her weight today, right?
That was her weight today, yes.
Okay.
This is her first dose, and she was just admitted this morning. So that was her current weight and her current height. We got a height on her when she came in. So.
Okay.
So let's see, we're going to round that off to 1.73 times 375 milligrams, which should give us 648.75. So
Okay.
648.
All right,
Good.
sounds good.
Let me just double check our lab work with you.
Okay.
If you don't mind doubling
No,
that?
not at all.
Okay, so let's see, we have a ANC of, it looks like about 3,000, and a platelet count of about 150, so we're okay on platelets and that.
Okay.
The weight should be within 10%, and that's okay because this was her first dose, so we won't have that to go by, and the physician doesn't look like he rounded to the 5%.
Okay.
And, okay, so we have a physician signature when the order went downstairs, an RN signature signed off on it going down, 2 chemo nurses did. Pharmacist signatures on there. If you wouldn't mind just double checking behind me here as the second staff nurse on the way back, and I'll get someone else to check it for me at the bedside when I'm ready to hang it.
Okay.
Okay, thanks for your time. Have a good one.
Okay.
So this is basically the patient cancer treatment summary, which summarizes what treatment you have received at your hospital stay, and this basically tells the type of disease you have, the date it was diagnosed, and basically your stage of disease, and also refers that what treatment we planned. It also mentions about your performance status prior to starting treatment, and what your performance status is currently at the end of the treatment, and also tells the drug regimen we choose to use basically treat your disease. This lists every drug which will be used in the regimen, and basically the doses of each of this regimen, and also tells that we did not dose reduce any of your chemotherapy drugs, and we also used a growth factor to basically help boost your white blood cell after you received chemotherapy. Since we didn't have any problems with the treatment, we basically mentioned that there was no toxicity which you developed as a result of chemotherapy. Also, it mentions that we basically are going to assess your response after the treatment is completed, after the required number of chemotherapy cycles, and we are not planning at this time any radiation therapy for your treatment. So this basically will be helpful for you to know what we're doing right now, and so you can, if you have to go to see your local oncologist, he will also know what treatment we gave you and what day the chemotherapy was administered and what were the side effects you incurred as a result of the chemotherapy.
This is really nice. This will be nice for me to be able to have as my own patient treatment summary to carry with me when people ask me what kind of treatments I've had. This is a nice aspect that you give to your patients.
Yeah.
Thank you very much.
And it tells you your diagnosis, so it helps you read more about that, and if you have any questions regarding your diagnosis and the stage of the disease, you can talk with me and with your local oncologist as well.
Okay, thank you very much. And I get to keep this copy. Thank you.